Would the county clerk's office please conduct roll call?
Brett Duncanson,
Here.
John Bonaprise,
Here.
Brad Olson,
We'll
Pam
be
Gard?
doing this, I think.
Pam Garvey,
Yes, I'm here.
Tony Johnson,
Here.
Bill Oliva,
Here.
here. Here, Dr. Rebecca Lyman.
Here. Okay. So with roll call, we will move on to approval of the agenda. Just as an aside, we have had Supervisor Olson request that we move our discussion regarding the state and local budget down on the agenda, as he will be joining us probably in about 15 or 20 minutes or so. So with that, I'd entertain a motion to approve the agenda.
I move the agenda as presented with the changes noted.
And a second.
I'll second.
Okay, very good. Motion's been made and seconded to approve the agenda with the aforementioned changes in the order. With that, is there any discussion? I will call for a vote. All in favor, respond aye. And anyone opposed? Okay, very good. As an aside, I have an ear infection and I can't hear out of this ear. So if you're to my right, please speak louder because I can't hear. Okay, and then moving on to item number 4, which would be approval of our minutes from the June 10th, 2025 meeting. Hopefully everybody has had a chance to review the minutes. I'll look for a motion to approve.
I move to approve the minutes of the June meeting.
And do we have a second? And we have a second. Very good. Motion's been made and seconded to approve the minutes. Do we have any discussion? No, it does not appear so. And with that, I will call for a vote. All in favor, respond aye.
Aye.
And opposed? Okay, and motion carries. So moving along then to agenda item number 5, public comment for 3 minutes, not to exceed a total of 30 minutes. Do we have any members of the public here today who would like to make any comments? Does not appear so. Is there anyone online? And we have some folks online, but it does not appear that they would like to make any public comments either. So with no public comments, we will keep her moving along then. Number 6, receipt of information from supervisors not seated as committee members. Do we have any supervisors here who would like to add anything? Chair Luke is here.
Just absorbing all this.
Yes, okay, great. So with that, we don't have any comments there. We'll move along to item number 7, which is our update regarding the public nuisance ordinance and some discussion. That's something our committee's been working on for a couple of months now.
Okay, so we have met with Supervisor Garvey, who has volunteering some time to meet with us on the rewrite, basically, of the nuisance and human health hazard ordinance. So we did some discovery last month and agreed that we need to completely scrub and do a combined version of some cleanup that needs to happen, as well as addressing the nuisance piece of the ordinance. So we will hopefully be bringing it back in the next month or 2. Of course, it needs to go through legal and all of that process, but this committee will be the first to receive what we come up with for the draft.
Yeah, but I just wanted to add a little because we did thought at one point thought we were close. Got some I just want to just add, just so everybody's kind of on the same page, got some feedback from corporate counsel and then saw some additional things that you guys wanted to look into. So that's also why we kind of were gaining, and it's not like we've lost ground, but it definitely from their perspective, it's like, if we're going to go through it, let's make sure that the people that have to administer it are super comfortable with what it is. And so that's why it's kind of continued to take a little bit longer. We might as well do it. And as I expressed at when we met, it's like, at this point, I don't believe, since there's no one really pushing us to do this, I don't see why. I think it's okay that they're taking their time going through it and feeling really comfortable with what they're kind of trying to draft before they bring it to this committee. So is that okay if I elaborate?
Absolutely.
That sounds like a good plan, good way of doing things. Okay, and before,
Madam Chair, can I make it?
yes,
It's public nuisance it's one of the most complicated things that we can address as a board. Chairman Luke down there, he and I have been town chairman, and you've always got, I don't think there's any, I never saw a year go by that somebody don't come to the board and, well, our neighbors, they think that they're doing something that there should be an ordinance for or something. And the first, in the 20 years that I've been, I think it's been addressed every year. And the first thing that we got to consider in a ordinance is what's legal and what's not legal. If you got a complaint and you're going to take it to the district attorney and you're going to take somebody to court, first of all, you look at the law to see if that's a legal thing to do in the first place. And anytime you take somebody to court, you're spending taxpayers' money. And that's always got to be a concern if it's legal and if it's worth spending the county money on. And so as this progresses, I want to make sure that our sheriff is the main person that we contact, what he can do legally and what he can't. It's one of the most complicated things that I've seen on the board and never seen an answer to it. Just a comment of a little history on it.
well, thank you, John, it's good to have you.
I certainly appreciate the work that you folks are doing and I recognize the comments that people make. But never seen a solution.
Yeah, it's a tough one sometimes.
Well, people's rights are very, very going as far as what they,
Chair.
everybody's got a different lifestyle.
Yeah. Well, thank you. So, actually, before I move into the update of the crisis. Oh, I'm sorry.
So that's exactly what we're doing, Supervisor Bonaprise, what Supervisor Garvey mentioned is we're sorting out what belongs to the DNR, what belongs to the sheriff, what belongs to the zoning department, and what belongs to the health department.
Exactly.
So that's
the right
exactly
plan.
what we're doing.
The right plan.
Good. I also, before I move on to item number 8, I have neglected to welcome our new committee member, Dr. Rebecca Lyman. And this is her first meeting with us today, so we want to give her a warm welcome and thank her for her citizenship and her service by agreeing to take us on and be here. And I know that she'll have lots of valuable input for us along the way. So welcome, Dr. Lyman. And how do you prefer to be addressed?
Rebecca's fine.
Rebecca is fine? Okay, very good. Thank you. Okay, then we
Do you
will.
have any comment on, I don't know her.
I met
thought
you
that
at
we-
the
Know
Luck,
everybody here, maybe
Fish
we
fry.
could introduce ourselves.
sat next to me at the Luck Fish Fry,
That's what
smelled fry.
smelled fried. There you go. I knew your face.
Yes.
Yeah,
I'm from St. Croix Health now,
okay.
and I've been there for 29 years.
Ah, great. Great, very good.
I'm still there as of this moment.
I think you mentioned you had some retirement plan.
Yeah, I do family practice and administration.
Well, we have our little nameplates for us as committee members. Very good. So you have an idea who we are here, but please, if you have any questions or comments or anything, please reach out. I know Tanya will do a good job of orientation with you, so you kind of know what's going on. And then when we review our annual report as well, I was thinking that would be a good kind of jumping off point for you to get a nice overview of what our committee does here. So, thank you. Okay, we'll move on then to item number 8, which is our update from the Crisis Ad Hoc Committee.
Right. Okay, so we did get some information from Representative Duke Tucker last week that his budget request for was it 14 million? Over the next 2 years was not included in the state budget. The state decided to move forward with the DHS 31 emergency rule for the crisis observation facilities. And I believe that they have allocated some monies to Rogers Memorial to establish something in the Chippewa Falls area, along with some monies to Lutheran Social Services for some substance use facilities and treatment center in the Chippewa Falls area as well. So we're still digesting what that all means. And as a crisis ad hoc, I know in the email that they sent us, they encouraged us to get together and put an application in for a COOCOP is what they're called. But I'm not sure what that all looks like, if there's going to be a facility in our region, if one is needed. So we'll keep you guys updated as we learn more about the progression. And this is all like on the wings of the budget being passed. So there's just a lot to digest right now. And
Well, we'll kind of look forward to seeing how things kind of shake out with that.
yeah, I mean, we're very appreciative that the legislators have participated and heard us and listened, and, you know, that we have this partnership moving forward.
Supervisor Gar.
So just a question then, so they kind of reached out as far as to encourage you to the application, because so the concern is that if you applied because they are already putting money in Chippewa Falls, that it wouldn't be considered? Is that kind of the feeling, or just because it's all still really fresh, like not sure which way to move?
I'm not sure, because the Rogers Memorial is in the budget documents that are distributed here. But the email encouraged us to apply, so I don't know that there's double money to be able to.
Oh, got it.
So we need to figure that piece out.
Understand. Okay,
And
thank you.
if the Rogers Memorial is the site, then what does that look like for us?
Understand. All right. Thank
If
you.
it's already set in stone,
Right.
we're not gonna
Right.
waste time.
Absolutely.
Yeah.
The other component to that is just applying to open up a crisis care facility, and having money for that is one thing. Is it sustainable over
Right.
the future is another thing. So
Good deal. Huge, yes.
Rita?
Just a quick question. What is a COOCOF?
It's a crisis urgent care and observation facility, so it's a pre-Winnebago. So trying to divert people from having to go across the state for that emergency detention. If we can divert them and stabilize in the community, better for the person, better for the community.
Interesting. Supervisor Bonner-Price.
I've been in touch with the former representatives of Duke Tucker on this. And it's, the budget's already passed now. Governor Eber signed it, so they're starting to work on 27 now. But the legislature in the past, 2 years or 4 years ago, they appropriated the money to have a facility. But these 28 counties, I'll tell you that our appeal was to the legislature that, well, we can't find the money. They wouldn't find the money to run it. And they're never gonna find the money to run it until we take this into our own hands, and these 28 counties find a way to operate a facility. The legislature in the state, they'll provide a facility for us. But somehow we gotta take the bull by the horns, and our districts, there's about 2/3 of the state in territory, and the biggest population is about 1/3 of the state. And that's where the power is. They're never gonna give us the money to run a facility. We've got to take that into our own hands. And I think my conversation with Duke and trying to get this across to some of the other legislators, that this district has got to find the money to run a facility.
And Can I clarify that?
Yes.
So our ask was for positions, prevention positions in the meantime while these cook-offs are being developed. And that was from that original 15 million that was allocated to the HSHS system, Sacred Heart, that got closed. But I believe that that money went back into the general fund.
Yes, it did.
And maybe they've redistributed it to LSS and Rogers
It's
Memorial.
gone.
So it's gone for us. So our request was, let us do some prevention work while we're getting these facilities up and running, because it will take some time to get them up and running. So that's the piece that was not included. That was Duke Tucker's ask.
Any little help we get from grassroots up will help.
Yep.
I think we've made, some progress on that with having the ad hoc committee, and the summit that we had in Rice Lake is, some good first steps in the right direction on doing those things. And I know that we will be trying to maintain those efforts, moving forward. So thank you for that update, Tanya and Johnny.
This facility in North Tech at Rice Lake is, kind of in an initial stages, but there's a great opportunities there.
Yes, definitely. Okay, if we don't have any other comments from our committee, we can move on to our Community Services Division Annual Report discussion. We received our annual report, I believe, a month or two ago, and we have some questions and some review of that report today. So let's dive right into that. We should still have our report from when we received it. I'm just going to grab mine, get it out.
That's
So,
what it looks like.
yeah, that's what it looks
We're
like.
trying to get Dr. Lyman a copy because
Yes. So here we have it.
so
Pam,
this was just an opportunity to ask questions.
Yeah, absolutely. I'll start. And part of mine is just curiosity and trying to totally understand some of the different things the departments do. And so, and when I see numbers, I kind of like to try to have them make sense to me, or at least have them, relate so, one of them that stuck out to me was the Child Protective Services. That there were, from your numbers, there was 639 access reports, 491 screen out, 148 screen in. So, and then 53 cases. So I'm just curious. So in essence, we have people that report. So when a concern, so when a concern is reported, I'm assuming a report has to be generated. And then go on, just kind of explain because I'm seeing 639, but there's only 53 cases, which I know is not, I know they're not one in one, but can you just kind of walk through kind of what all that means?
Right, so we always encourage, if you're ever in doubt or have a concern, call our number.
Mhm.
We will take the information down. They will screen it to determine if we meet criteria to go out and do, meet a threshold to go out and do an investigation. So that's the screen in,
So this
screen
is the
out.
screening. Okay, got
So
it.
screen in means, yes, we've determined that there's enough information that we need to go out and do some more deeper dive.
Got it.
And figure that out. And you can correct me if I'm wrong on any part of this, because at the end of the day, though 53 will end up in Joe's lap. So once we investigate, again, still looking to see if we meet standards. So usually it's chapter 48 or chapter 948. If they do meet standards, to move forward to either like a CHIPS, a child in need of protective services, or a JIPS, juvenile in need of protective services, then they talk to Corporation Counsel and file a petition to get a court order for those services. So that's what those 53 cases are. And I will say 53 is low. So last year was a low year for us, and they were even questioning like, what are you guys doing over there? There's
answering
not
the
a
phone.
lot. And if you go back to the previous year or two, minus COVID stuff, but the trend now is like we're kind of off the charts with referrals and it's a lot busier now, wouldn't you say?
We have quite a few more.
Which isn't necessarily a good thing. but Okay, thank you.
Did you have anything more to add on that, Joe? Or it's like a Cliff Notes version of.
Right. And I knew that I just thought, I just appreciate trying to understand a little more. That's all.
So as these cases come in and they're kind of screened and processed on down the line, what kind of outcomes are there with these families? What happens or doesn't happen?
The goal is always to establish some sort of permanency for the child. So it's either with the biological parents, or it could be another situation like a foster home or adoption or something like that. So permanency is the goal.
I'm sure you asked a question.
Yes.
Do we have anybody at Lincoln Hills or any of the
Yep.
high priced?
We have one currently in juvenile corrections. They're not at Lincoln. But we feel like that's somewhat of a bargain right now because with the state budget, the rate that was scheduled to go from 1,300 a day up to 2,300 or whatever it was has now gone down to $500 a day. So we're gonna run with that for a while, but so that's in the budget documentation.
So how did that happen?
Governor Evers cut the fee down to $501 for the first year of the biennium and $738 for 2027. So
One of the better things he's done.
that was a big win for the counties
Yeah,
because they realized that it was gonna break some counties at the new rates. We're gonna really break the counties.
I mean, one placement will break us
Yeah.
at this county.
That's the thing for some of the people that don't realize is the maximum security that can break some counties' budgets. And are we at full staff on caseworkers?
Yes, I believe so. In Department of Children and Families, we've got a couple vacancies in behavioral health, but they're interviewing tomorrow. Today and tomorrow.
It just amazes me how some of our caseworkers can go out in the field without any deputies or whatever, and they get threatened and they're amazing people. We can't thank them enough.
Bill.
One of the things that I noticed in here, kinship care.
Yep.
The numbers look small, but I want to say something about the kinship program. I think that it's one of those hidden things, kinship programs that they have in the high schools, in the middle schools around the county. I don't think people realize how much that helps for keeping kids out of the system. I know that there's a growing number that keep coming into court, but you'd be amazed at the number of kids that are being helped through that kinship program, not only with high school mentors, but also with the adult mentors. And I think that volunteering to be a kinship mentor is one of those things that everyone should go through. And it's, I just want to kind of throw a plug in for them, because I think that's one of those little hidden gems in the county.
Yep, and I think what you're talking about is kinship of Polk County, so the nonprofit,
Correct.
the prevention program.
Yes.
That's keeping these kids out of court orders, providing them mentorship,
Correct.
right?
Yes.
And so, yes, they do wonderful things. And I'm thinking the kinship you're looking at is
Yeah.
probably the
It is,
kinship
but
program.
what came to mind is because I know that there's the three versions that you have here. It's either voluntary court ordered, or it's going to be a long-term care. But I think they kind of go hand in hand.
Yep, absolutely.
So
So
that-
there's typically confusion on, there's two kinships here. One's the nonprofit, one is that state administered program that we do. So that's what
Right.
you're hitting on the nonprofit piece. So yeah, if you're not a volunteer, sign up. I think that's what you said.
So those are not one and the same.
They're not one and the same.
Oh, okay.
Correct.
Thank you. Thanks for
Thank you.
plugging that. Beth.
They have a big impact. Big
absolutely.
positive impact on people's
Absolutely.
lives. Yeah. That's,
All right. Yeah, I got more, sorry.
no, you go for it.
So under the behavioral health, you've got community support programs. It talked about 17 clients served, but 16, and again, I'm sure that it's not, I'm not sure, but not meeting expectations, so we're discharged 16 of them for not meeting expectations. I mean, is
So I don't know
that,
if, Lisa, do you want to speak to that? Why people
What?
discharge from?
Where are you seeing the, discharge disposition?
Yep, not meeting expectations of program 16. So is that 16 out of the 17 clients were
That's
kicked out?
the disposition number.
Okay,
So there's a number that correlates with the disposition, so a transfer to another county. I think that's just my understanding, and I can look at that just to double check for you, and maybe that's an error. I know that there has been one discharge for not meeting expectations, but there's not been 16.
okay. 'Cause I'm just looking, it's like, so
Yeah.
again, if we have 17 clients and 16 of them were kicked out for not, is
They're
there a
also
miss here?
getting new clients too.
Right, I just-
So, yeah. So
Let's
she
see how
can
the numbers are kind of like,
Yeah, it says discharge is one and then discharge disposition is a
Right.
higher number. Yeah. I see what you're looking at.
That needs to be clarified.
yeah, is it,
I need to look at that.
okay. I mean, is it like a miss in the program or is it a miss in kind of how it's reported or?
Well, we'll do a little, bit of a deep dive on that.
Yeah.
And do you want to just be in touch with Supervisor Garvey on that? And
I'm happy to.
Sure.
Or I can bring it back to this group as well,
So
whatever.
what I can do is email it to the group.
Why don't you
blank
do that?
copy,
Yeah.
When we get the answer.
Yeah, that would be
Then you guys
great.
have it
okay, good.
more quickly than next month.
Yeah.
And then just my final one was the Great Rivers Consortium, if I understand that correctly. So do we have 3 total people that are employed by Polk County that support the Great Rivers? Are we an internal call center? I guess is what, as I was reading through this, do we have 3 employees that are an internal call center for this Great Rivers Consortium?
No, we are a virtual call center with 10 counties.
Right, okay, but I mean, but we have 3 people that are from Polk County that are,
No, we
No.
have 12 with me, 11 staff. They all are in the call center 50% of their workday every day.
okay.
So they take the calls from any county in the
Right,
counties.
Right. I was just reading, because it said, there was one manager and, I guess lead workers got it and then got it. Now, then support specialists. Sorry. Okay. I kind of just breezed over it. So, but you said, so that's 50% of their,
50% of their workday, whether AM or PM, is spent in the call center setting.
okay.
And then the other 50% of their day is doing case management.
Sure. Cool. Because that seemed like just a huge, those are big numbers, but I realize it's a big territory too. So cool. And that's all falls under your umbrella then, Diana?
Correct.
Cool. All right. That was all I had. I just, like I said, just wanted some more kind of just general understanding. So I appreciate the report. And I appreciate the feedback
And
or the information, I should say.
yeah, and thanks for bringing your questions forth because it's really educational for all of us, to dive a little bit deeper into it. Do we have anybody else who has any other questions about the annual report? It's good to get this and thank you for all of the work you do to pull all this information together for us as well. Okay, so are we ready to talk about the fee schedule?
We do.
Oh, I'm
want to,
sorry.
Just as part of our annual report, the satisfaction surveys, we
Oh, yes.
had a couple of months of labeling it or making it date certain. We have the results now and I'm just distributing what the survey results are. We had four board members complete the survey. And of the 4, it looks like you are satisfied with the questions asked, and the questions are the same every year. So between the weighted averages, between, 2.25 and, there is a 2, and 2.75. So that is in the satisfied bucket. So nobody was somewhat satisfied and nobody, the 0 unsures, all in the satisfied bucket or the very satisfied bucket of the questions we were asking. So if you have questions on that, we can answer them, but report. And we do this for our level 3 health department certification. So it's one of the pieces that we need to measure every year.
Well, thank you to the 4 of us who completed the survey and turned it in. And no news is good news, I guess, for those who didn't respond. Why, there must not be anything they were too fired up about. So with that, I guess I would say that, we have an overall satisfaction level, which is a good thing. So, with that, do we have any questions or comments about that at all?
Do you have a minimum that you need for your report? As far as percentage of the board or anything? You just
So
have,
you mean for the sample size?
right,
Oh,
No.
I should say
Each
committee.
year we'll try to improve to get more and more voices heard.
lock you in
Yeah.
this room next year until you.
That sounds perfect. I just didn't know. I mean, since it was a required report, is there a, a minimum requirement? You have to have a certain percentage of the committee to respond. That was the question.
They might ask us to increase our marketing on it to get a better response, but
Perfect. All right, thank you.
Madam Chair.
Yeah.
Are this criteria here, is that specific to Polk County or is that?
yes, this committee here.
Yeah. Committee, how the
I
committee
thought
is
the
run.
questions were fantastic.
Yeah. Yep.
That it really, every one of them is hit home.
Okay, we will move on then to agenda item number 10, which is our discussion of the fee schedule that were just handed out to us. If we want to take a look at that.
You might need your magnifying glass for the.
Yeah.
I tried to get it on as small. Less. But it's not much to report. The only fees that were increased on the microprints are the licensing fees for restaurants and campgrounds, and probably the tattoo parlors, and that's based on the state fees increasing. So DAC increased their fee, that money that we owe them back for the licensing. So that's just reflected in the.
Just passing that along.
Just passing that along.
Okay,
And then for community services, the behavioral health clinic, we increased the fees for driver safety plan. That's the intoxicated driver program that we administer, and then also the alternative education. So that's a part of that diversion that they're able to get a reduced.
No, nothing is reduced. It's just that they haven't been found to need treatment.
Okay,
So then they go to an educational course.
And the reason why we had to increase those is because our staff costs went up. The alternative ed is a weekend thing because people are working. And so we pay premium pay now for that. So that is reflected in there along with the other staffing plan increases. So that's just being passed on to the consumer so we can cover our cost.
okay, very good. Do we have any other changes or from last year that you would like to call to our attention?
No, I could just say though that like for our fee schedule, we set the fee and we have a spreadsheet that we put all of our costs in there and come up with the fee. Most of the time our payers don't reimburse us the full amount. So it's, a matter of, it's our actual cost, but there's an adjustment that's made. So in any clinic setting, if it's Polk County or if it's St. Croix Health or whatever, you're only getting what the insurance is paying. And I think 57% of our consumers, about 57.
In the clinic, for the clinic services, it was 70% are Medicare and Medicaid, so we can't negotiate those rates.
Yeah, it is what it is. And it's,
We're gonna be looking at the other insurances though, but I know like Health Partners just actually happened to send us something about the rates going up for 26. So, and a lot of like on the bottom, there's that case management. Those are Medicaid only programs. So the rate is what Medicaid pays us. And
we can set our rate at $500 an hour, but they're only gonna pay us.
Yeah.
$150 or whatever.
Yeah.
That's good to know.
Madam Chair, is this something that we need full county board approval, or is it just internal?
It will it's part of the budget, so the administrator will include that in.
It'll go to general,
County.
once they go through all the committees and it goes to general government, then general government makes a recommendation to go to county board, and August will go to county board.
Thank you for the answer.
Did we have any other questions or comments regarding this?
The only other thing you'll see on the public health is we did roll up some of our stuff to bundle it, just because we aren't doing as much as that repo health stuff. So we kind of labs and stuff. It just says remove everything because we just put it all in as cost. So you'll see on there, we don't have the rates for everything, but just because we're bundling our lines, just to make it a little cleaner. And maybe it won't be in micro print next year then if we were.
If you have questions on this one, though, we can do you want to readable or get you a.
I was just gonna say, how does this compare with some of the surrounding counties
As far
as
as,
far as fee schedules?
well, they compared the environmental.
We did that last year. We did a lot of rate increases last year and we got it from 2 or 3 other counties to in line with that and then did some time studies. I know for the IDP, Lisa, we got the information from some other counties that offer those services to compare them also.
Yeah.
So to make sure that we'd also don't want to just raise our rates because we can, right? We want to keep it in line with, covering our costs and going from there. So,
Okay.
so I would say pretty comparable for people who, and not every county has a clinic and those types of
Correct.
things. So.
Okay, thank you.
Looking around, doesn't appear there's any other comments or questions. With that, the update on the state and local budget.
We'll need an action to approve the free schedule,
Oh, we do. Okay. Is
please.
I so move it for approval.
there a second?
Second,
Okay, motion has been made and seconded to approve the fee schedule to forward it on to the next steps. Do we have any discussion on that? Here's not. With that, I'll call for a vote. All in favor, please respond yes or aye. Opposed, same sign. Okay, no opposed. And with that, the motion carries. Our update on the state and local budget, we wanted to,
We have Jennifer go first for
Yes.
transportation.
yes, sure. Come
She's so patiently waiting.
Oh.
there, So.
on. Okay.
Hi, everybody. My name is Jen Torgerson, and I'm the Mobility Education and Outreach Coordinator for the Aging and Disability Resource Center. And we have in our department, it's transportation, and we have 4 different transportation programs. And I'm just going to talk a little bit about our programs and give you an update on kind of what we're doing and where we're at with those programs. We'll start with our volunteer driver program. The ADRC has a volunteer driver program that provides non-emergency transportation for medical appointments and for any other activities of daily living for residents of the county who are 60 years and older, or any adult living with a disability. This is for Polk and Burnett County. Transportation is coordinated through the ADRC. And rides are provided by our volunteer drivers who are reimbursed for their mileage at the full IRS rate. And then the client is typically charged half of that to cover part of the cost. We have wheelchair accessible vehicles available as well. And we've seen quite a bit of a rise in need for those vehicles to be utilized for appointments. So we're just really busy with scheduling those out. The participation within Polk County has grown quite a bit within the last year with our volunteer driver program. Pulled some numbers in July of 2024, and that was like the first 6 months of the year last year. We had provided transportation to 112 individuals at that point. And this year at the same time, we've provided transportation to 179 individuals, which is 67 more individuals from this time last year, which is huge. Between myself and our transportation coordinator, we've just been very busy with that. We've provided last year 1,125 rides for the first 6 months of the year, and this year we're at 1,632 rides, which is just a huge increase. We have gotten a few more volunteers, which is wonderful, but there's always the need for that. And so we are just doing the best we can with what we are working with and trying to recruit more volunteers. Like I said earlier, we've seen an increase in people needing wheelchair transport. And we've gone from 104 rides last year to 155 rides this year at this time. So our vehicles are getting used a lot, and we are looking to start a procurement process and bidding for 2026 to get a couple of new handicap accessible minivans, one for Polk and one for Burnett. Ours is getting some miles racked up, so we're just wanting to make sure we have reliable transportation. So that's kind of what we're looking at in 2026. Our social drive program is, I'll quickly just say that we have our handicap accessible van and bus, and our transportation coordinator does coordinate social trips for residents of the community, either people living with disabilities or seniors. And that's published in our voice newsletter every month, which I brought some copies of that, and that's sitting on the chair over there. If anybody would like to take one or share one with someone, these are great trips provided at a very low cost to residents who would like to get out and do group activities. That has also increased in ridership, 73 rides last year and 236 this year. Yep. Yeah. And I think part of it is some outreach, some word of mouth. I think our population is aging. I think people are more in tune to looking at information online, looking at information that we're handing out through newsletters, flyers, things like that. So it's just growing. I'm just going to talk briefly about our trike program, which is slowly making an exit. We have a battery operated trike program through the ADRC, which has been in operation, as far as I know, that I can find, since 2017. This program is to assist in the ADRC mission, and it facilitates this program for residents 65 and older. Our ADRC board bumped the age up from 55 to 65. 65 and older, and any age with disabilities who reside in the county. We're kind of making an exit on this program just because we need to focus more on purchasing new vehicles and providing actual transportation services as opposed to doing this, which this trike program has been extremely popular, as we have over 100 people on the waiting list to receive a trike. These trikes provide a stable and powerful alternative to a traditional bike. It provides additional options for mobility for people who need it, less physical exertion, and it offers an alternative to receive, instead of getting a ride from someone, maybe they are able to utilize this trike to get to the store or to go to a meal site or even to employment. That's kind of how they've looked at it in the past. This year, we're going to be distributing 6 trikes in Polk County to people who have been on the waiting list for years. In the past, they've done more like between 20, 40, 60 trike distributions, but this year we're doing 6, and we're kind of stepping away from that for a while at least. So all of the programs that I talked about are funded through the Wisconsin Specialized Transportation Assistance Program grant, which is called the 8521 program. The program's purpose is to improve the health and welfare of these populations by increasing access to transportation. And we also have county levy that goes into that. And we're just really busy. And we're hoping that within the next year or two, we could add another part-time transportation coordinator to our group, our group of 2, to assist in coordinating more rides for these people. The last program I'm going to talk about is the mobility management program. This program started in 2024. And it was created in the result of the 2023 County Transportation Feasibility Study, which identified some unmet transportation needs, including medical, social, grocery trips, and education and employment, needs for transportation that were not being met. And this program is to basically help with increasing the knowledge of transportation resources within our communities, and being able to educate people on what the resources are, help navigate on a one-to-one level what is available, what would work best for a person in their in specific scenario. And increase access for people that are needing transportation. So looking at 2024 with it being a new program, I'm compiling 2025 statistics, but in 2024, there were about 435 people reached through coordinated contacts with service providers, which contributed to working with 139 individuals on a one-to-one level to help them access transportation in whatever way, shape, or form each individual needed. So with talking with service providers and spreading the word that the service is available, we were able to assist with that amount of individuals. We did a ton of paper outreach last year to just kind of spread the word about the program. We put a flyer in the yellow paper, which did, reach quite a few people, obviously, with the amount of yellow papers that go out. Whether, people are reading that or not, we did get an influx of people calling after that went out, which was great. We did a lot of outreach through our voice newsletters to talk a little bit about the mobility management program almost on a monthly basis. A lot of transportation information was put out there within flyers and brochures. And I brought some today that I'm just going to leave on that chair over there if anybody would like to take some of those. So we've, in total, trying to just keep track of stuff, there were 60,771 paper outreach resources distributed last year. We also put an ad in the Intercounty Leader. We have internet and Facebook access. We're still working on putting together an online application for our voucher program, which I'll talk a little bit about quickly. We have a mileage reimbursement voucher program. This is geared towards people in our community that already have a driver. They have either a friend or family member or neighbor, maybe possibly driving them to their doctor's appointments or their activities of daily living. This program is, it includes two options, one for seniors and people living with disabilities, and one for anyone who is low income. And that income table is located over on that chair as well, if anybody would like that. The vouchers are used for financial reimbursement for the person's driver. So we offer this program up to 150 miles per month if the person has a driver. They can be reimbursed up to $105 a month to reimburse their driver. This empowers people who can't drive themselves to maintain their independence by making their own travel arrangements, similar to how they would if they were driving themselves. It kind of fosters a sense of self-sufficiency in a way, having access to a variety of transportation options. So this is just another option for someone who may not think that there's this resource. There is this resource, and it's proven to be helpful for, independence, it's another option. It saves on, utilizing other resources, et cetera. We currently have 34 active participants in the voucher program. Some have been temporary participants because they've had a temporary health issue where they're unable to drive themselves and they've had somebody helping them out. Some of them have been with us from the very beginning, are unable to drive for various reasons and have somebody taking them to their appointments. We've seen a handful of people follow through with the application process of the low income program, but we only have 2 people participating in that voucher program. So we have a total of 36 participants. So this mobility management program and the voucher program is funded through a grant. It's for enhanced mobility of seniors and individuals with disabilities, and it's a federal grant. So it's quite competitive, and we were lucky to get it in 2024 and 2025. We are in the application process of 2026, and that is due in August, and we hope to receive federal grant money. We're also using some of our 8521 dollars to supplement through Burnett County. And we're just growing by the day. Does anybody have any questions? I tried to go through that as quick as I could.
8521, where's that from?
8521 is state, that's state funding, and the 5310 is federal funding.
So sounds like the bulk of this then is funded through grants and the state and the federal monies, and the cost to the ADRC and the counties is minimal as far as providing these services go.
Yeah, there is county money involved as well. It's a match. They require a match, so it's 20% match through the county. And that's for 8521, and 5310 is also, I believe, 20%. But you can also use in kind. There's a lot of stuff that goes
To
in.
minimize the actual cash.
Yeah. Yes.
For
Yeah.
dollar funding.
Yeah.
I know I saw this presentation also at ADRC board as well. So it's really successful of how the numbers have risen, certainly as the programs go on, and indicates the need, that there is for the services as well. So anyone have any questions or comments for Jen? Yes.
You've got some amazing growth numbers there. And I think one of our responsibilities as a supervisor is to have the vision of the growth in our county, because it's here. I go to the town meetings in Alden and Farmington and the village of Osceola, and the building permits for the month of June in town of Farmington, which is not, and I'm sure that Jay and especially the townships south of Highway 8, I'm not as familiar with. Looking forward to comments from people north of Highway 8. But for the month of June, the town of Farmington had 22 building permit applications. They weren't all residents, but it's the reality of the growth is here. And these things are just gonna keep on growing. We've got to see within probably the next 5 years where we're gonna be and how we
Yes.
complete
Yeah.
all these.
There is a lot of growth, and, we also would like to look in the future, sooner rather than later, of expanding services to be able to serve other demographics as well. I mean, it would be great. But we're just moving along at our pace and trying to keep up with everything, but it's a great program and there's a lot of potential.
It's one of the best in the county, and the other factor is our county aging people population is growing. The
We do have a growing aging population as well.
And the success of your program. Definite impact.
Anything else?
Did we have anything else? Nope, okay. We're going to move on then. We're going to kind of save our local and state budget maybe after our next agenda item. So update from our medical examiner on the scatter plot.
All right, let's bring the mood down.
They have a sense of humor.
I do have some cool little looky-loos that I'm gonna pass around for people to kind of use as a reference. They're old historical plot maps, and outlined in orange is gonna be the location of the cemetery that we are gonna be talking about today. All right, so the purpose of the Polk County Unclaimed Remains Scatter Spot is to assist funeral homes with the final disposition of the unclaimed remains of Polk County residents. We would also like to give back to the members of the community who truly have no other options after death by providing a respectful service and peaceful final resting place. My name is Jamie. I am the Chief Medical Examiner for Polk County. I did kind of just get right into it without introducing myself.
I was gonna get that for you, Jamie.
I'm labeled. I kind of take advantage of that. So, our location, as you can see in the plot maps, it is the corner of 110th Ave and 120th Street, and it is due south of Lake Henneby. This is a picture of the road view of the formerly known Polk County Poor Farm Cemetery. Here's just some more views. These crosses, unfortunately, are not labeled. We do not know who they are. Some historical significance. The Polk County Poor Farm, believed to be operational between 1874 through sometime in the 1950s. It is unclear when it officially closed and was sold off. The cemetery was used for residents who passed away and had no assets or family. As of now, we know of 4 descendants that have been identified and logged there. I think you can go next. We'll have some more pictures. This is an example of one of 4 confirmed names, as you can see. He died in 1883, so there is some historical significance to this plot of land. I think as of now, there are 28 crosses. Per the Polk County Poor Farm records, which were originally referenced at the University of Wisconsin River Falls Area Research Center. There was a fire at the Poor Farm main dwelling house in 1876. This could potentially explain some of the loss of records. However, it has been unconfirmed. Unfortunately, we don't know who's there. And I think the probability of us knowing who's there, quite slim. We could click next. Here's Lake Kenneby from the north end of the property. Very beautiful, very pretty, small little plot. Here is the proposed spot for our memorial stone. I will show you a picture of the memorial stone. It is being supplied by Melgard Monument out of River Falls. They had a spare stone, and they were willing to use the spare stone and engrave it, and then they will bring it to the location, set it up. There will also be a bench provided by the Amory High School shop department, and the bench will be placed with the memorial stone. The sign that you guys saw in slides previously were also supplied by the Amory High School tech ed students. Here's just some other landscaping. Very nice. Okay, so here is a proposed stone provided by Melgard. The inscription will say, "In memory of those who passed away in Polk County, Wisconsin, without family to claim them, we pay homage to their time spent here and honor the lives they lived. There is also a quote by Gordon Pinsent that say, "May they rest in eternal peace." So these additional installations, again, Melgard Monument, Amory High School. Special thanks to teacher Alan Carlson for the Amory High School, who I was in contact with, and he set up these projects. Polk County will also utilize an online database that will provide the decedent's name, date of death, and town of location. This will assist family members or friends who are searching for the decedent to be connected to their final resting place. We are seeing a pop culture interest in genealogy, and so that will also be beneficial for having this Google search engine. It will be a tab that will be located to the medical examiner tab on the Polk County website. Danny Sill is assisting us with that. Next. So, prospective service for scattering of cremains. Cremains is just cremated remains. Cremains will initially remain at the funeral home that provided service until the required time has passed and the funeral home has considered the ashes unclaimed. Cremated remains will be considered unclaimed after 60 days per Wisconsin state statute. Ideally, as beautiful of a piece of land as this is, the idea is that the use of this plot will be rare as needed. Consider it a very beautiful last resort. One Polk County case has been determined as unclaimed since 2023. Polk County Medical Examiner coordinated cremation of this person, and now the cremains have been stored at a local funeral home. So the idea is once we are contacted, after exhausting all measures to locate or contact the decedent's next of kin, the Polk County Medical Examiner's office will contact our guest, Polk County Chaplain Barry Schaefer. A date and time will be scheduled to scatter the ashes at the Prairie View Cemetery. I have asked Chaplain Barry Schaefer to be a part of this project because I would like there to be some sort of service for cremains that are going to be scattered. I think that we can do so much more for people than just scatter the ashes. I think that a scheduled service would be appropriate. So the goal is to assist deceased residents, again, who do not have anyone available to retrieve their cremated remains. The purpose of this plot is not to provide a cost-effective option for families. The goal of this is for cremains who have been unclaimed at funeral homes. We don't want them in storage. We want them scattered. We want them put to rest. It will not be used in cases of truly unidentified remains, in cases of John Does or Jane Does. While those cases are rare, they may happen. We do not cremate John or Jane Does. We bury them for ID purposes. Forgive me, I am nervous. All right. That's it. I breezed through that again, partially due to nerves. So if I skipped over anything, if you guys have any questions, please ask them. Yes.
So first of all, I want to thank you for taking this project on, and I want to thank Pastor Barry as well for helping with that. I do family genealogy, and I know how important it is to restore some dignity, respect, certainly to human cremains in a very sad situation, as it goes. So I just want to thank you for taking this on and for dealing with this as well. Is there any other comments or questions?
I just had a quick one. So are Jane and Joe Does buried there as well?
No,
Where-
not documented now. So in cases of true unidentified remains, there's two sides to it. Bright side, technology is very, very advanced. We have more options of confirming ID than ever before. Across the river, we have the Minnesota BCA who has assisted past rural medical examiners with DNA testing. The downside to that is even though the technology is there, the technology is slow. So it can take a few months typically In cases of true unidentified remains, say skeletal remains found in a very rural area where there is that have been exposed to the elements and there's little DNA to be extracted from the bones, then the Polk County Medical Examiner's Office will pay for a burial of the remains. The purpose of a burial is because you can't uncremate someone, but you can exhume someone.
Sure.
So the idea is that they will be buried as a John Doe or a Jane Doe. And as more time goes on, more investigation, if there's an option, if someone says, yep, my uncle lived here in 1985, he lived on this plot of land, we haven't talked to him since, then we can exhume and use some of those bones for.
Right, I'm just curious about where are you, I mean, just where you
It-
can find an available
so-
spot?
Typically, we would reach out to local cemeteries and local funeral homes.
So it is, okay, just,
It's,
you can,
yep.
okay,
Most likely, the way that I would approach that problem is to reach out to the local funeral homes or cemeteries of the area in which
Sure.
the person lived.
Okay.
There's nothing kind of set in stone. Luckily, I think our last truly unidentified was in the 1993 in Dresser Township. She has since been identified as a Pearline Walton. So, since 1993, that's been a problem that we haven't had to approach, but I have faith that our community will solve the problem if it happens.
thank you.
I just have a comment. The public and public-private, effort with the school doing the bench and the monument being donated, I just think that's really.
I do have a list of people that have assisted. Again, Mr. Alan Carlson with Amory High School. The Polk County Museum provided documentation and plot maps. Polk County Sign and Highway Department, Polk County Community Services. I've reached out to Attorney Michael Sharkey, who is a mortuary law specialist, along with Melgard Memorial. So there's been a lot of hands helping out with this.
Just got a comment. Say I thank Jamie for her work on this. I mean, when she came looking for, they needed a spot for a scatter plot. And it's just like, got the perfect spot to do the research on. It is a county-owned cemetery. Although it was known as the Poor Farm Cemetery, it was established well before the Poor Farm. So the research and stuff with the Prairie View Farm on there, which did raise some flags as this was a cemetery that a gentleman tried to take over at one point for direct burials, which had a similar sign. Just to make sure that, that those calls were cleared up and
Yes.
the right name is on the cemetery now. But again, thank Jamie for her work on this and wonderful job. And we have now a final resting place for these individuals.
Absolutely.
Don't be nervous.
Huh?
Don't be nervous.
And I just want
I
to say.
deal with the deceased population.
Right.
So
Not the living.
apologies. I mean, humor is a coping mechanism. So.
And there is a gentleman that lives adjacent to the cemetery that asked to be able to maintain the cemetery, and he was granted that to do that. So
Wow. Yes, when it is all done, the intention of the medical examiner's office is to have and invite the people who have assisted with this, as well as the invitation to you all will be extended. And to have everyone come out and see the final finished product. I think just a little bit of time has gone on since, making the stone and getting the bench set up. So the end goal is to have, once it's all completed, to have everybody who's been a part of it out there. And we do have cremains that will be ready to spread. So we will reach out to Pastor Schaefer and we will be able to have that person put to rest there.
Did you take over from John Denny's?
I did. Yes. Last year was my first
I
year.
apologize. I didn't realize that John had retired.
Yep. He retired from the ME. I think he's still doing
Do we still have a contract for autopsies
with Midwest.
yes.
No, we do not. It has been, it was open as needed autopsies. As of now, we utilize Ramsey County Medical Examiner's Office due to some past issues that John had vocalized with Midwest, along with kind of the treatment of their pathologists to small rural counties. and we've used Ramsey County, and as things are growing, we will just see who is the best fit for.
Ramsey County's a good.
We've also been able to use our own van for transport that's been provided by the sheriff's office, which has saved us prospectively last year in transport. We paid funeral homes approximately $11,000 in transport. And now that we can do our own transport, we're saving that for the taxpayer as well.
And the autopsies are expensive and they come right out of our county.
Yep.
Good work.
So we're able to also maintain a chain of custody for our cases as well by having the medical examiner's office be allowed to do our own transports. So the person will never leave our custody. It goes from Polk County ME's office directly to the secure Ramsey County Medical Examiner's office, and never once do they be released to a private third party.
Thanks.
So there's been some big changes.
Good
Good
work.
to know. Thank you.
Any other questions?
No, thank you for the report. Thank you also, Pastor Barry, for joining us today.
Is there, question for a minute, is there a lot of townships that that own a cemetery?
Typically, most cemeteries are owned by the municipalities and the towns, yes.
Farmington owns a cemetery, Alden owns a.
I think just about every municipality
Lincoln?
has one.
I think statutorily, the townships have to accept abandoned units or cemeteries. And I certainly want to thank Polk County and their effort to determine who actually is responsible for this one. We finally got it. Yeah, I'm so happy that Polk County has taken the responsibility, because it can be quite expensive for small townships to, and they're doing a fabulous job out there. And the complaints that not complaints, but the inquiries that we got with that man was trying to take over the cemetery here a couple of years ago is back when they started putting up some.
Is that in Lincoln Township?
It's in Lincoln Township.
Yeah.
I thought it was, yeah.
It's in Lincoln Township.
Pretty much straight south of here, right? Across 8.
Yes.
It's finally getting some recognition and effort that has been sort of bounced around and neglected for years, and I've followed it very closely since the 50s,
Whoa.
so.
Are there 28 cemeteries in Polk County?
That number I do not know.
The reason I say that is I think the Veteran Services Officer mentions that every year in his report, because they do all of their Memorial Day services at those. And I thought he said 28. I could be wrong.
I go to all of them with them.
Yeah.
I
Yeah,
think
get the
they
flags
also
out and-
mentioned all the number of flags that they put up on holidays.
Everybody gets,
See if we can chase that down for you. Yep, set it in our update.
Thank you.
I think we're ready for our update regarding the state and local budget.
Yes,
Yes, you passed these out already.
I did. Well,
Um,
if you didn't, they're on the tables. There were 3
there was 3 handouts there.
handouts.
One-
Yeah, I got it.
These are hot off the press.
Yes, one was the state, budget for HHS and how, what was in the budget and what was not included in the budget. That'd be the first one without the smaller header on there.
It says WIXA on the top, I
So-
believe.
So it's on the top. The NASHTA one is how the federal bill affects, health and human services, with counties. As with the state budget, I'll jump back and forth here. With the state budget, one of the things with behavioral health, I already talked about, was the $10 million, reserve for the FOOs or whatever, the crisis units to be able to do. The other one was $10 million for the, mental health campus in Chippewa Valley. We'll see how that goes. Last biennium budget, they put in $15 million. Unfortunately, the facility closed. And that money just sat there and reverted back to the general fund. So optimistically, we have high hopes for that. Another big win, as we said before, was the state lowering the fees for juvenile detentions to $501, which is a huge impact for our budgets. So you can go through and look at what was in the budget for us on the state side. One of the national level, with the big beautiful bill that they passed. One of the things to look at is on, it'd be like page 3, second down, the SNAP administrative costs share. The federal, contribution is going from 50% to 25%, October 2026. Wisconsin is one of 10 counties that this affects, because we administer SNAP through, the state and counties. So we'll keep an eye on that one. And along with the different, eligibility mandates, we'll take a little more staff time on, verifying the eligibility for people in these programs, along with the Medicaid program. So those will take an eye on there. On the right-hand column of that one, it kind of gives you the idea of where, the implementation date is on there. One of the good things out of the federal budget was they left municipal bonds alone. So they were not taxed on municipal bonds, which is huge for us. That is a win for, counties across the United States and local governments on that. So we did see increases in the state budget for Veterans Affairs. We saw them for 5% for ADRC, the general ADRC. However, there's no increased funding for home delivered meals for elderly and disabled. No increased funding for public health services, adult protective services, birth to 3, or Medicaid expansion. So, in that document, you can see what was in the budget and what was not included in the budget. So, as a local level, we're chin deep into the budget right now. Looking at extra funding requests from departments. Although the budget's tight, we had $6 million worth of requests for extra for projects and staffing changes and other things. So vetting through that with Don and myself and getting the details and the division directors, been going through those items. Fee schedules go to general government then and the board in August. The outside agencies are going in front of general government starting tomorrow, the first set. The next set will be in August. Just a note, the library rate that the board sets, that'll be going in August to general government. Currently it's at 95%. That's from a resolution 4820. It stays there. If that rate changes, we just need another resolution to adjust that rate. So FYI on that. But that's kind of the outlook right now on the budget as we're going through departments and where we can save money and be more efficient. So.
Okay, thank you.
Sure, Supervisor Olson's online. I don't know if you had a comment on how the prices state budget went.
He's muted.
Oh.
Thanks, Mo. Thanks for adjusting this for my timeline out here, Madam Chair. Yeah, I think, while we didn't get what we necessarily wanted out of the state budget for locally, I think the fact that Chip was getting $10 million for a facility 2 years down the road will certainly has huge impacts for us. Getting kind of what we were looking for long-term in a couple years. I think that is a big deal for us. And if it falls apart like it did last time, I think we're in good shape to go ask for that money, seeing as though we already have from joint finance. So thank you.
Thank you, Brad.
Madam Chair.
Yes.
So this is a lot to absorb. It's a lot of paper, a lot of reading. We have a meeting, our state, Wisconsin Counties Association, our advocacy group is digesting all of this. We have a call next week with them to look at what that impact is for the state and the county. So we'll be able to bring back more drilled down information probably at the August meeting as we unpack all of this and see what it really means for dollars and cuts. It is concerning, say that.
So this will be a good item then for our future agenda item
Yes.
for next month, as we'll want to revisit this and gather more information. Thank you. Do you have any other questions or comments regarding this? We are going to be talking about it next month. We haven't had a lot of time to go through and digest this, so maybe we will revisit it then.
Yep.
Mo, do you have an update for us?
Just a short update, sales tax for June was down 6% from 2024. We're still up above 2024 overall, 4%. Keep an eye on that for our budget naturally. Clam Falls Dam, the actuators are in, however, there's an issue with the actuators actually operating the gates properly up and down. So the engineers are working on that, and just to make sure it's out there that Rod Polk, they're watching the flowage and keeping the elevation at 1,023.5 above sea level. That's the optimum where it's supposed to be. So he's daily watching those things. So by my last item to do, very proud to say that Helen has met her education requirements for the health officer position. So her official appointment criteria and all that has been met now. So hats off to Helen and congratulations on that. So
Okay. Mo, do you have an update regarding the commercial kitchen project?
not a huge update, as Golden Age Manor has got it, have new staff online for finance on that. I'll be setting up meetings with ADRC and Dana in the future here to look at a pilot program to see how we can do Meals on Wheels out of their kitchen, if that's possible. So not a lot of progress, but it's not forgotten.
Do you have an update regarding housing?
The same update. We have no new applications for housing.
Okay. And then Helen, you have a communicable disease report for us?
I sure do. It is tick-borne illness season. We are comparable with our Lyme's disease in 2025 versus 2024 year-to-date so far, about like 27 cases. Anaplasmosis cases are elevated compared to last year at this time. We're continuing to watch the measles outbreak so far, knock on wood, no measles cases reported confirmed in Wisconsin. But nationwide, we're up to 1,267 cases. 92% of cases have been in unvaccinated individuals. 12% of cases have been hospitalized. 21% of kiddos ages 5 and under are being hospitalized and still at 3 confirmed deaths. And then last Thursday, Public Health issued a water advisory on South Twin Beach and Amory due to high levels of fecal coliform bacteria. So we test weekly, and we have to have 2 consecutive weeks of adequate levels before we can lift that advisory. So we are still waiting on the results of that next test following that. So that's what I know.
Okay. Sounds good. Any questions or anything for Helen? Okay. Legislative event report. Johnny, you got anything for us there?
I'll be going down the month of July. We have a representative from Polk County Steering Committee to the legislature. I've got 5 meetings month of July. 2 of them are virtual, and then there's one in Wisconsin Dells and 2 of them in Wisconsin Rapids. The 26 budget is now official. Governor Evers signed the budget last week. And my question was to Administrator what your comments was, and it sounds like Polk County is going to get some benefits out of our 26 budget. Something is better than nothing the way we look at it. One question I had, we don't have anything as far as the agenda in our September state meeting as far as resolutions from Polk County. Last year I introduced 7 and they all passed. The one thing I don't know how it all, if we got anything through the budget, was we had a resolution passed from our sheriff's department to fund our rural fire and EMT and departments out of the reserve fund for 1.5 cents per capita. right now, our rural fire departments are all in a lot of trouble there. I believe right in the county, I think, one town fire department has only 2 active people. And so I believe it rings in 3 other departments, Milltown, Centurion, something. And so they said, if there was a grass fire, well, it would ring in all over and that would be more of an expense. They don't know how to regulate it. We've got a lot of problems in fire departments and EMT and so stuff there. Gotta have continual
Right,
input on.
that's on the agenda for August for Public Works, Public Safety, to discuss that topic.
Yeah, I've been talking to them and we thought we'd get it on the August County board. Something we need discussion on in our whole county.
Yes, and as you mentioned, the state budget, there was many wins in the state budget. Transportation had 3% increases for GTA, general transportation aids in both years. The routine maintenance agreements for highway with the state highways got an influx of approximately $34 million. They kept the ARIP program for agricultural roads, LRIP-S for that was maintained at 150,000 or 150 million. Conservation was up, funding those positions, and that shows a net gain of, I think, 67,000 on the water conservation side. So there was many wins in the budget for the counties.
What was the result of LRIP? That affects all our townships.
LRIP was maintained and sustained with their levels, but
So
they
they
kept the ARIP program and funded that again also. for
Huge,
agricultural
huge
roads.
to Polk County.
Yes.
Thank you.
One other, Madam Chair, one other comment. I believe, Mo, are you familiar that Alton Lake Centurion and Milltown Fire Departments are gonna merge?
Yes,
That's what
Yeah.
resulted in this.
that's part of the discussion for the Public Works, Public Safety meeting as they look at incentives for, is there anything the county can do with incentives for these fire departments to maintain their staffing levels? We do have money set aside for training for emergency responders. Can't remember their resolution number, but they're looking at, can they modify that to open it up for even more?
Okay.
So hopefully next month I'll have some good news as far as our steering committee meeting. So
Thank you, John. Our subject matter for our next meeting, we already talked about that we're going to revisit our updates on the state and local budget impacts to us. We also will be talking about the county budget and having the public hearing for our budget. So we'll be meeting at 8:30 instead of 9 a.m. We looked at the fee schedule today, so we won't be doing that next month. Again, we won't have anything there. Okay, and that actually is,
We'll just move down the GAM child support VSO and the mid-year reports. We'll move into August from July.
okay, that sounds good. All righty, looks like we'll have our work cut out for us there. If we have nothing else, I'll look for a motion to adjourn.
move to adjourn.
Second, okay, any discussion? Never is. Call for a vote, all in favor?
Aye.
Aye. Opposed, nobody ever is, and with that, this meeting is adjourned. Thank you, everybody.